Hello everyone, my name is Dennis and welcome to the YouTube channel DankGH, your number one and trusted CBT and OSCE learning platform. If you are here, thanks for watching our videos. Kindly do well to subscribe and watch the other videos as well. Thank you. So previously, I've done a video on the 7 platforms. These are platforms or areas that you should expect the CBT questions to be coming from. So we have 7 platforms and I shared that one on the channel. So if you've not watched that video, kindly do well and watch it. What we'll be doing today is consent. What it means to get consent, types of consent, what consent is considered valid, and situations where you don't necessarily need consent from the patient before you can carry out any procedure, treatment, or maybe investigation. Consent means that someone giving you the permission to carry out a procedure, treatment, or maybe assessment on them. So as a trained nurse or a midwife, you are bound by the NMC code of conduct to seek patient consent always and respect their decisions in whatever they decide when it comes to treatment or maybe any assessment or whatever you want to do for them. So consent is something that you should really know how it applies when it comes to your practice, and that is what we'll be discussing today. Before consent can be valid, right, or before we can say that oh, the patient has given me consent, certain conditions need to be met. First of all, it has to be voluntary. That is, the patient should give you the go ahead out of their own free will. They shouldn't be under any pressure, or we try to always impose our will on patients. Now, when you do that and the patient gives consent, that is not considered valid. So for consent to be valid, it has to be voluntary. The patient have to come out from your own free will. Another important point is they have to be informed. Informed means that they are well aware of the situation at hand, their actions, and whatever if they decide the consequences that come with it. So assuming the patient needs blood, you need to give them all information about the blood. If they receive it, what will happen? If they don't, what will happen? And in case they don't want the blood, what are the other alternatives? As a nurse, you also to give the information. Whatever decision that they make, it is out of their own will, and you have to respect it whether you agree with that decision or not. So just give them the necessary information that they will need to make the decision. If you do that, then it means it becomes well informed. They are well aware of the situation and the consequences of their actions. Another point is the person giving the consent should have the mental capacity to make that consent. It means that they should be in the right frame of mind, understand the information given, and be able to make a choice out of it. If the patient cannot understand the information, or maybe they have any mental health condition that prevents them from understanding the message that you are putting across, it means that they cannot give consent to treatment. If it happens that way, it means you need to sort out what the policy says in those circumstances. So these are the 3 conditions that you need to meet before a consent you obtain from patient can be considered valid. Consent can either be verbal consent, it can be written, or it can be implied. So the verbal is me just telling you, yes, I understand you can do this. And written is when you sign a form or maybe a written document. Another aspect is implied consent. With that one, there wouldn't be any verbal or any written document. However, the actions of the patient tells you that they've given you the go ahead. So for instance, if I want to check your vital signs and I say, can I check your vital signs? And you just bring your arm for me to check, it means that your action is speaking well that you want me to take your vital signs. So that becomes implied consent. So in the UK, the age where one can give consent is 16. So that is the legal age of consent. However, there are certain circumstances where someone below the age of 16 can equally give consent. So that is something that we call the Gillick competence. Below the age of 16, people can still give consent only if they understand the situation at hand, they're able to make decisions and interpret the information that you are giving to them. So that is what we term as Gillick competence. In cases like that, it means that parents do not need to approve consent for the child, right? So ideally, most countries, once you are below certain age, it means automatically your parents are the ones to give consent. But in the UK, they are saying legal age is 16. If you are even below the age of 16 and you are matured enough to understand what is at stake, you can equally give consent without the approval of your parents or maybe your guardian. There are certain times you don't necessarily need consent, right? So one is in emergency situations where a decision has to be made to save someone's life. Maybe the person is unconscious, there has been an accident, the person is unconscious, and you cannot trace the relatives or whoever is the guardian. In such instances, it means the medical team or the healthcare professional have to make decisions based on what is at stake. However, it should be in the best interest of the patient, not within your own personal interest. No. If the person has a mental health condition that prevents them to make informed decisions. So, for instance, they lack the mental capacity. In such cases, you also don't need consent. In addition to that one, if there's a threat to the person or to the public as a whole, maybe someone is aggressive, suicidal, they have certain mental health condition that maybe they can harm themselves or other people as well. The person at that moment does not have the power to make consent or give approval of treatment. So in such cases, the person can be detained or sectioned based on following certain procedures or policies. So in such cases, you also don't need consent. Right. So you can try your hands on these questions and maybe drop your answers at the comment section. I'll review them and give you a feedback whether you had it correct or not. The first question is, which of the following is true about Gillick competence? A child can give consent if they are intelligent, mature to understand the information given and its consequences. B, parents are to give consent always if the child is below 18. C, children can never give consent. And D, none of the above. Number two, when do you gain consent from a patient and consider it valid? A, only if the patient has the mental capacity to give consent. B, only before a clinical procedure. And C, only after a clinical procedure. And D, none of the above. Number three, while taking consent for under 16-year-old, which statement is true? A, only age 16 to 17 can give consent. B, consent are allowed to give, children are allowed to give consent after their parents say so. C, children who are intelligent with competence are allowed to give consent. And D, none of the above. All right, thanks for watching, and I hope you enjoyed today's discussion. Check out other videos on the channel as well. That is whether you are a midwife, adult nurse, or mental health nurse. And we have other exciting videos that will help you with your CBT exams preparation and OSCE training as well. Wherever you are, we wish you all the best in your exams, and we hope to see you in the UK someday. Thank you. Bye bye.